systems. 3, increase public awareness and knowledge. And 4th, private sector collaboration. These 4 pillars are designed to address root causes and deliver transformative health outcomes for American children. We will now hear a bit more on how each commission member will play a part in carrying out these strategies into the future. But first, I would like to note that in the interest of the Commission's commitment to transparency, we have invited the press to cover this event today, including through a live stream. And one programming note for the media, President Trump will be taking the first follow-up action on a strategy contained in today's report at an event at the White House later this afternoon at 4:30 p.m. And now I'd like to begin by asking Secretary Kennedy to give opening remarks.
Thank you very much, Vince. And you talked about an initial interest by President Trump back in, and I saw a tweet back in June of 2000 that he did that was about specifically about the chronic disease epidemic. And I called my campaign manager, Amaryllis Fox, and I said to her, I could have written that tweet. And it was one of the, I had been campaigning a lot of the issues that President Trump and I were campaigning on were the same. A lot of the ideas that he had about war, about the forever wars, about the importance of restoring jobs in the country and revitalizing the American middle class. These were all my preoccupation. My biggest preoccupation was the chronic disease epidemic. And we are now the sickest country in the world. We announced this week, CDC announced that 76.4% of Americans are suffering a chronic disease. And my uncle was president, it was 11%. In 1950, it was 3%. And we're the sickest country in the world. We have the highest chronic disease burden of any country in the world. And yet we spend more on healthcare than any country in the world. We spend 2 to 3 times what European nations spend. We spend nearly as much in our country for healthcare as all the other nations in the world combined. And yet we have the worst health outcomes. We've lost 6 years in lifespan and longevity to Europe in the past 20 years. Our kids, our girls are hitting puberty 6 years earlier than historically. Our young men have sperm counts that are half of what they ought to be. They have testosterone levels that are half of what they ought to be. We have diabetes that is now